Good afternoon. In the last year and a half, the National League of Cities has been excited to lead a collaborating partnership on Let's Move Cities, Towns, and Counties. This initiative allows NLC to be able to provide local elected officials with technical assistance that draws upon subject matter expertise. It supports peer learning opportunities and offers customized guidance through webinars, conferences, calls, and other methods. NLC is proud to work on that initiative as a partner with the U.S. Department of Health and Human Services. We are especially thankful to the First Lady and Secretary Sebelius and Assistant Secretary Dr. Howard Koh, who just walked into the room back there, for their leadership and commitment to ensure that the nation sees real gains in improved childhood obesity. I'd also like, if we could, because I think I see a number in the room, just to acknowledge the Let's Move Cities, Towns, and Counties team. If they could just stand and be recognized really quickly. I see Tracy Wheat, who's our project manager, Rosie Henson, and Robin McKinnon in the back with HHS. And it's been a great opportunity for us to be able to work with them, because in just a year and a half, we have been able to engage over 400 local elected officials and communities across the country that have committed to the 5 goals of Let's Move Cities, Towns, and Counties. And I present this in my remarks because I think it provides an opportunity, particularly in the conversation that we're having around childhood obesity solutions. 8 years ago, when I joined the National League of Cities, this was not what the map looked like, right? We literally had looking to find mayors that were looking to engage in issues related to childhood obesity where they thought that they had a role to play in this work. NLC has done a number of things, and obviously for the sake of my time, I can't really walk through all of it. I highlight some of it on this slide, both in terms of producing action kits and working in partnerships with the American Association for School Administrators, doing work down in the South, working with small cities, urban cities, large cities as well, to give us insight into the work. And so we've seen the movement for us over the last 8 years grow. And so as I think about the work around sustaining city leadership, for me, I think about it in, particularly as we're having this conversation, in 5 areas. I think in terms of what city leaders can do and are doing in this work across the country, I think it's reflected in their ability to engage a diverse range of stakeholders. They have the ability to be able to convene and bring stakeholders to the table, including healthcare systems and business community and young people and parents. And so as you think about their role of being able to create a table where we're not having siloed conversations in the cities, but we all are committing to this larger goal of around what do we want our communities to look like. They have that ability and are doing a number of examples of how they're doing that across the country. The other piece that I think is really important that we've seen evolve over the last 8 years is how mayors have gone from this is not our responsibility to we need to figure out how we combat childhood obesity, to now this conversation about how do we promote healthy communities. For me, that's a very different evolution that has taken place in the last 8 years about where we are and what that means. And so within that conversation, I think it allows for a rich set of conversations around policy strategies that can be implemented at a local level. How do you, with the ability to be able to bring people to the table, have a set of conversations around shared accountability? And shared accountability is really setting some common language and indicators around what does success look like. How do we know that we're creating healthy communities? And also, how do we know when we're not in terms of consequences for failure? And what are the infrastructures that need to be in place? And so as we're thinking about sustaining city leadership, for me, I think a lot of it is embedded in these 5 areas. And so the one of those areas I wanted to focus specifically on is around policy, particularly as we're talking about sustaining policy, sustaining leadership at a local level. Mayors come and go. And so we're very mindful of that. And so what can mayors do to be able to sustain the work that's happening in their communities around creating healthy communities? And we know that, and everyone in this room and listening know that there's a balance that needs to happen that's focused on developing and sustaining effective interventions that promote physical activity, access to healthy foods, and healthy eating among children and youth. And so from a policy perspective, the National League of Cities, the work that we did has allowed us to see a range of different policies where mayors are increasing recreational opportunities, policies that are focused on that, as well as policies that are focused on improving access to fresh and healthy foods. But for me, the framework of how we think about advancing a comprehensive strategy, particularly at a local level within cities, can be captured for me, in a fairly simple framework. As we're doing the work that's happening around the country, are we reaching the high-risk populations that need it the most? And what are the efforts that are happening in cities to make sure that we're reaching the high-risk populations? How are we affecting strong partnerships? We had a session earlier today that talked about effective partnerships with schools, but we can now expand that conversation because we realize that there are a lot of partnerships on the ground that need to be at the table. And how are we thinking about a framework that are bringing those individuals, the range of individuals, to the table? How are we making the most of after-school programming or out-of-school time? A number of mayors have responsibility in that space. And so it's a helpful framework to make sure that's a part of the work that's happening on the ground. Promoting access to nutritious foods. We know that mayors have the ability to be able to influence conversations with business partners, right? And making sure that there's opportunities to promote healthy and affordable foods, particularly in low-income neighborhoods. Just about every city is responsible for parks and recreation. And how are we utilizing that as a resource within cities, both in terms of looking at programming and promoting physical activity, but also the kinds of food that's being served to young people through those parks and recreation. And then the built environment, reshaping the built environment. And there's a lot of work that's been happening across the country and really creating more accessible, walkable communities. So for me, it's a helpful framework to be able, for the conversations we've had with cities across the country. But I wanted to offer a term that I think is built on Dr. Deed's earlier point, as he was really giving us a sense of where things are with this childhood obesity epidemic. And it's a term coined by Dr. John Powell called false universalism. So Bill had laid out a sense of where we are, both looking at it from a race as well as gender. And there's a lot of knowledge we know about who's being impacted and where are we seeing outcomes being improved for the range of population in cities across the country. And Dr. Powell would suggest that taking a universal approach that is not sensitive to the needs of the particular can have an uneven impact. And so false universalism, which is a term that he used, assumes that targeted policies that address the needs of certain populations become a divisive wedge. And it also assumes that everyone benefits from universal approaches. But universal approaches that are not sensitive to the needs of the particular are never truly universal. They tend to have an uneven impact and can even exacerbate racial inequality at times. And so Dr. Powell argues that we need to be universal in our goals, but not in our process. And I think that's really important as we're looking at the range of policies. And so we know that there's great success of cities adopting policies. As I mentioned earlier, we could run down the list of policies that we have seen at the National League of Cities around increasing recreational opportunities. Or we could do the same. We're looking at increasing policy opportunities for access to fresh and healthy foods. But what I think is really important when we're talking about solutions in this space is how are these policies targeting the populations that need it the most? And are they happening in communities that are not necessarily needing the the investment. And so I think that for us in an approach around targeted universalism is really where I think this conversation around health equity is embedded. And really where I think, as we're talking about obesity solutions, where I think it would be really helpful for us to be spending time really understanding what are the solutions that are connected to better effective policies. So I really wanted to end my remarks there and just give you a website to learn more about the work that's happening around the country around Let's Move Cities, Towns, and Counties, and look forward to the conversation we'll have in a little bit. Thanks.